Well, now to our final session of the Health Summit. The World Health Organization has declared climate change as this century's single biggest health threat. And every day we're seeing that play out closer to home. Earlier this summer, Ottawa ranked among the worst cities in the world for air quality. Sustained high temperatures across Canada have resulted in a record number of forest fires from British Columbia to Nova Scotia to the Northwest Territories. The 2023 wildfire season has led to dangerously poor air quality, and thousands of Canadians have been forced from their homes. Exposure to wildfire smoke is not only associated with harmful health effects like increased respiratory and cardiovascular conditions, but it also leads to increased hospital admissions that strain already stretched and under-resourced health systems. Yet, the health system is part of the problem. Healthcare is responsible for an estimated 4.6% of Canada's total greenhouse gas emissions, more than both aviation and shipping, making us one of the worst healthcare polluters per capita in the world. As contributors to the problem, we have an important role to play in the fight against climate change. And that's why the CMA is advocating for environmentally sustainable health systems in Canada, with a focus on reaching net zero by 2050. The CMA's new policy includes recommendations on climate adaptation, resilience, emergency preparedness, and net zero targets, and outlines actions governments, health administrators, and practitioners can take, from reducing waste to rethinking health infrastructure across the continuum of care. Healthcare should be sustainable. Now, in this next session, the last session of this summit, you'll hear from two leading experts in climate change in Canada and meet three physician advocates who are passionate about creating a greener future of healthcare. The Honourable Catherine McKenna was Canada's Minister of Environment and Climate Change from 2015 to 2019. She was a lead negotiator of the Paris Agreement, negotiated Canada's climate change plan, including a coal phase-out and price on carbon, brought in a new Impact Assessment Act for major projects, and doubled the amount of nature protected in Canada. Internationally, she co-founded the Powering Past Coal Alliance and the Ministerial Meetings on Climate Action. Catherine is currently founder and principal of the global advisory firm Climate and Nature Solutions. Please join me in welcoming Catherine McKenna to the stage.
So Adrian's faking an injury just because there's doctors around. Maybe they could help him out. It's great to be here. I want to start by recognizing we're on the traditional territory of the Algonquin and Anishinaabe peoples. I also want to start by acknowledging that we're in a climate emergency. And I have to tell you folks this because you just have to turn on the news. It's funny, Dr. Howard and I were talking here before, and we're like, okay, what's the mood in the room? And then we were like, what's our mood? Well, we're pretty pissed off, I'd say. Thinking about all these people. On the thing we call, I guess, X or whatever the heck it is, which now they won't let you block folks, so I may definitely have to leave now. It's just horrifying, the stories. And this is where we're at. And so while I'm going to talk about a net zero healthcare system, I'm also going to talk about the massively important role you folks in the room play when it comes to talking about climate change in a real way with people. Because we have to connect this to people, and we have to have people care. We have to have people understand that it is man-made and it's fossil fuels that cause climate change, and we have the solutions. But we're gonna have to fight. And it's too bad we have to fight, because it's kind of stupid when you've got a problem and you know the solutions. But it's not obvious that we're actually making as many advances as we want. I was just looking online, new survey came out that there's been a drop in the number of Canadians that think that climate change is man-made. We're now 6 out of 10 Canadians. There's a whole range of reasons: disinformation, massively problematic, politicians who deny the reality of climate change, fossil fuel ads everywhere saying that Canada, if we burn more, we're gonna be the solution to climate change. It's bonkers. You guys are doctors, you're in the healthcare system, you have direct relationships with folks. Please, please, please be out there. All right, let's get going. So the symptoms. You just have to open any newspaper, or go online, or turn on your TV to just see all the symptoms of climate change. And these are the health symptoms. I mean, look, you can look at any of these pictures. First of all, if you look at the one talking about how Indigenous peoples are disproportionately impacted by climate change. We've seen that in NWT. We're seeing that in Kelowna area, but we see that across the country, and often those stories aren't even told, because they're outside of where the majority of Canadians live. You can see a picture of the Nova Scotia floods. 2 kids died in those floods. There are kids with their families trying to escape. You can talk about the boy who was 9 years old who died of an asthma attack. Think of how many kids have asthma. How many people have asthma, have respiratory problems? Often those are folks that are very vulnerable. They're young, they're elderly, they're people who have, different health challenges, often living in poverty. Think about what happened in 2021 when we had the heat dome. Yes, the town of Lytton burned down and basically incinerated, which was appalling, but at the same time, over 600 people died because of how hot it was in Vancouver. Lyme disease, other diseases that we don't think of that we would be experiencing here. You can hear about dengue. I got dengue fever, not very fun, but I didn't get it here. Got it in Thailand. And then, of course, there's ecological grief. I have 3 kids. Every day they ask me, what did you do to help tackle climate change? Often I say I went to meetings and spoke, and they're like, well, all right, could you do more? But what's happening with kids is such a crisis. Like, I can't even imagine every day waking up and thinking about climate change. It's in your face. No wonder they're mad. No wonder they're marching in the streets demanding change. And it's funny, because when I was minister, folks kind of said to me, is it terrible when kids are marching the streets and saying your government isn't doing enough? It's like, that is awesome, because I needed the support, including inside cabinet. And so these are the very real health impacts. I mean, we could go on and on. I mean, there's so many different impacts, and we're quite fortunate in Canada. I mean, imagine if you live, we saw what happened in Maui. But in sub-Saharan Africa, these huge droughts, destroying crops, but killing off so many people who are desperately poor already. And that's just where we are now. Now, I'm not a doom and gloom person. I'm just a realist. I'm an optimistic realist, or sometimes a realistic optimist. But the reality is, like you folks, you got to understand the problem, and then you got to solve it. So, what's the diagnosis? I know this is maybe imperfect in the way you guys talk. I'm just a lawyer, not a doctor. But what are we talking about? Like, what are the signs and symptoms that we see? We're seeing what's happening here, so what's going on? Well, it's fossil fuels. Fossil fuels are by far the largest contributor to climate change. 75% of greenhouse gas emissions, nearly 90% of CO2 emissions. And the reason I say this is you probably know this, but it's really confusing. Because if you go to an airport, if you go on a train, you open the Globe and Mail, there's gonna be massive ads by the Pathways Alliance of oil sands companies saying, don't worry, like, we're net zero, we can just continue burning, and climate change, we're all part of the solution. If we don't actually understand what the problem is, we're not gonna be able to solve it. The problem is the burning of fossil fuels. That doesn't mean we're gonna get over them overnight. But the good news is the scale of the innovation and the price of renewables and other solutions is going down precipitously. But at the same time, we have one industry that does not want to change, making obscene profits that they could plow into clean. They know how to do large-scale projects, but no, they give it back to their shareholders through buybacks. They do large executive compensation, and what do? They go do more new fossil fuel infrastructure, which the International Energy Agency has said, we cannot have new fossil fuel infrastructure if we want to meet the goals of the Paris Agreement, which, by the way, every country in the world agreed to. So that's it. The problem is the problem. So we have to just always be aware. I mean, beyond the fact that we have 40% of Canadians who don't think that climate change is man-made, I think if you ask folks, do you think that greenhouse gas, that fossil fuels are the problem, it would be even lower. The prescription, okay, what do we actually really need to do? Well, we've got to limit warming to 1.5 degrees. People have agreed, the whole world's agreed to that. That means net zero by 2050, but I kind of hate the number the year 2050. Because for example, my son said to me, 2050, aren't you gonna be dead by then? And I said, okay, yeah, I'm hopefully not gonna be dead by then, but I get it. It's really about reducing emissions by half by 2030. That's a lot, reducing emissions by half by 2030. Now, we're making progress internationally. I was I was very fortunate, new minister went off to basically 2 days later to the Paris Agreement negotiations. And we, at that point, were really far off where we needed to be. We were probably facing over 4 degrees of warming, maybe 4.5 degrees of warming based on what governments were doing then. We brought that down. If governments do everything they need to do, and by the way, that's very hard to imagine that governments will do everything they need to do, we'll be at about 2.3, 2.4 degrees of warming. We need to be staying 1.5 degrees. We're already feeling the impacts. Think about the impacts if we are not able to stay in that range. Literally, it's going to impact, I saw a stat, 3 to 6 billion people will not be able to live in a habitable area by the end of the century. Climate refugees. Although we have climate refugees in our own country, as someone was talking about that. It said, add my name. I live in Yellowknife. Add my name. I live in Kelowna. I'm a climate refugee. So I was asked by the UN Secretary General when I left politics to do a report on net zero. So net zero, what are the standards and criteria for net zero? Because we don't live in a fact-free world. 90% of global emissions are covered by a net zero target. Once again, that's like this long way out there target. It's really about, okay, you're gonna say that, there's price of emission. And the way I put it, I used to be a competitive swimmer, I still swim. Anyone swimmers who go to Meech Lake and do swim, woo, swimmers, or special breed. It's like you have a stretch goal. So when people are like, it's really hard to do 1.5, I was like, yeah, climate change is hard. That's the thing, we gotta tackle it. So, but that's your that's you got this net zero goal 2050, and then you gotta do the work now. Like when I was swimming, I wanted to go to the Olympics. Well, the time I was doing it at 12 was definitely not gonna get me anywhere near there. Then you gotta get up on the blocks, you gotta perform according to your plan. And if you don't, then you have to innovate, you have to adjust, and you gotta do more work. Really, it's about doing the work. Spoiler alert, I didn't go to the Olympics, but I did make Olympic trials, and I went way faster than I ever expected, and I dug deep, and that's what we all have to do. So very briefly, the report, you can read it. We tried as with experts globally to make it like readable and not in weird climate language. You need to have a long-term goal. You need to have short-term science-based targets. You don't get to make up your targets. They have to be based on the science of 1.5 degrees. You need to do real action versus buying credits. You need to have a real plan. Like, what is your plan for the next 5 years? You need to do positive climate lobbying. I have lots of people who come into me and they'd be like, yeah, that's great, you guys are doing these things. And then they go to finance and they'd be like, don't do any of that, that's terrible. And so we need people who are positive lobbying, and I'll come to that in what you guys have done, doctors have done, and the very important role you play. No new fossil fuel infrastructure. We need to be not destroying nature, but protecting nature. We need to be reporting transparency and with accountability. And we need support. Under all of this is a just transition. And it's not actually that hard. Let me explain what this report really is. Emissions need to go down now. Money needs to scale to clean now. And we have to be focused on people. That's really what is required. Of course, it's like, I'm very like lawyerly and kind of like, you got to do these things. But that is kind of this kind of like overarching what we need to do. So why should you care? Well, the healthcare system is 4.6 of Canada's emissions, and it went up by 1.3% between 2018 and 2019. Probably went up in the pandemic because a lot of single-use plastics, I get it. So the great news is the CMA has a goal of net zero by 2050. And I'm not going to go into all the reasons why this is good, but being part of the solution, everyone needs to be part of the solution. You can't tackle climate change if everyone isn't doing their part. And you also can have a broader impact because of your supply chain, because of your purchasing power, because you can divest investments in fossil fuels. So the UK is highly sophisticated. I will say it's a world leader. So as you think about this, the CMA is doing a great job. But you got to get into the weeds. And you don't need to look at this chart, like it's actually pretty hard for even me to see. I don't like my glasses on here. But what's important about this is there are emissions you control. And then you could say, well, I don't really control the electricity system. Like Doug Ford wants to do more gas. Like, what can I do about that? In our net zero report, we make it clear that you need to be tackling not only your own emissions, but the emissions that you can have an impact on. So it includes your electricity system. You can have an impact. You can go tell them we don't want that. We actually want renewables on the grid. Or your supply chain. You can go to your suppliers and say we want you to be reducing your emissions. And that's really how we can have multiple impacts on this. The UK NHS, what they did is they have a 2040 net zero goal for everything they control, the emissions they control, 2045 for things they don't control, as I say, like electricity decarbonization. But they prioritize lobbying and getting governments to act. So you'll see Dr. Howard, I'm a huge fan of her. You guys have been awesome. You may not all have been directly involved, but through the CMA, through CAPE, through other international bodies, a lot of support on key policies that we needed to land as a government were supported by doctors, including at the Supreme Court, that we had interveners that were doctors saying that climate change is actually a health issue. It's a health emergency. But carbon pricing, putting a price on pollution, that's not very easy to do because people are like, not entirely sure about that. We give all the money back. That's important for folks to know. But you were very supportive. Doctors were supportive of carbon pricing as one of the key tools. Coal phase out, obviously also critically important. You were very supportive of that. And you're doing a bunch of climate campaigns. So that's what I want to leave you on. It's good. I'm kind of like right on time here. But I mean, there's a lot more to say. But what I would say is just one, keep it up. Continue to be advocates. 2, yes, tackle the emissions in the healthcare system, both direct and indirect. 3, lobby for positive change. But 4, when you meet with people, talk about climate change as a healthcare issue, as the biggest healthcare issue that we face. It's an exacerbating issue to everything else and is a direct health issue. Thanks.
You want to see? thanks so much, Catherine, for getting us started in such a powerful way. So thank you so much. Our next keynote speaker is no stranger to this audience. Dr. Courtney Harewood is an emergency physician in Yellowknives, Dene First Nation, Northwest Territories, and a climate change and health researcher. She has researched the health and environmental impacts of menstrual cups and wildfires, and led policy work and advocacy regarding eco-anxiety, vaccine equity, active transport, plant-rich diets, fossil fuel divestment, carbon pricing, and coal phase-out. Courtney is a CMA board member and was the first woman president of the Canadian Association of Physicians for the Environment, CAPE. She is vice chair of the Global Climate and Health Alliance and is on the steering committee of the Planetary Health Alliance. Please welcome Dr. Courtney Harewood to the stage.
Use the clicker. Okay, thank you. Thanks so much. Thank you. Nice to meet you too. I think I'm advancing this. I'm here to tell you that no matter how dire it seems, what you do really matters. You can imagine that this is a difficult day. I have been an emergency physician in Yellowknives Dene Territory for over a decade. At this exact moment, the 100-bed hospital, Stanton Territorial Hospital, that serves an area that includes the subarctic and the Arctic, that serves 30 majority Indigenous communities in an area the size of France and Spain combined, is being emergently evacuated. My best friends are in charge of this evacuation. They haven't slept in I don't even know how long. They never thought they would need to do this. And I know, because we've done curriculum surveys, that you haven't been briefed on climate change and the health impacts. So this is your briefing, all right? I'm an emerge doc. I manage emergencies in comfortable shoes. I'm ready. You ready? This is gonna be fast, okay? So I wasn't taught about climate change in medical school. I learned about it when I was on my way up to a locum in Inuvik, which is above the Arctic Circle. It's already 3 degrees Celsius warmer than when an 80-year-old elder was born. I had no clue that it was a health emergency. I didn't have a book on my way up there. One does not go to Inuvik in the middle of the winter without a book. So I was running through the Edmonton airport. I picked up a book on climate change thinking, well, I should probably know something about this. I'm an adult now. And read it on my way up and was immediately very alarmed because I didn't know anything about climate change, but medical school did teach me how to read a graph. And so by the time I got off the plane, ditched my bags and did a literature review because that's what nerdy people do. And I found the Lancet Commission's first report on climate change and health, which came out in 2009, which said that climate change is the biggest health threat of the 21st century. I was like, what? I thought the only thing I did do in my 20s was learn about health emergencies. And I started asking around. Many of you know me, when I get excited about things, I ask out, did you know that climate change is the biggest health threat of the 21st century? And the people in Inuvik were not surprised. They said things like, well, I didn't know that, but my cousin went through the ice on the way to his cabin last week, and it's getting very difficult to hunt and to fish because the caribou are having trouble with their passage on ice, and the fish are all moving around, and the trees are tipping over because the permafrost is becoming very, very thawed. And yeah, that sounds possible. And so I was very, very lucky that I went from there down to the Family Medicine Forum in Calgary and met Warren Bell, one of the founding presidents of the Canadian Association of Physicians for the Environment. So I went from that moment of peak dissonance, oh my God, it's an emergency, I don't know what to do, to someone who was able to help me figure out what I could do. And that's what I would ask every single one of you to do today. Okay? This is not something we manage alone, no matter what the fossil fuel related misinformation has told us. Okay? So this is an emergency. This is my hospital. I'm thinking about it very, very much right now. We are used to and trained to resuscitate complex self-regulating systems that we walk around in every day. This is our piece of nature that we get to walk around in. The time I did this the most was when I was working for Doctors Without Borders in Djibouti, resuscitating severely malnourished children between the ages of 6 months and 5 years. When we worked quickly as a team, we were able to pull semi-stable little humans out of instability and into health. When we were slow, the organ system started shutting down the way you know that they do, and at a certain point, our treatments didn't help and they died. The first time a child died under my care was in Djibouti. When that happened, I swore, and then I sat down, and then I realized I had to keep going because I still had 50 other kids to round on. By the time I was done, I realized that I could spend my whole life at the bedside and there would still be malnourished children, and that climate change was their biggest risk for developing malnutrition and continues to be. And if I really wanted to fix malnutrition in children, I needed to go home to where we have one of the highest per capita carbon footprints in the world and work to decrease it. And that's what I've been doing ever since. So unfortunately, my home is also one of the most profoundly affected places in the world. In 2014, we had what we called the Summer of Smoke, SOS. And that meant 2.5 months of wildfire smoke that resulted in a full doubling of emergency department visits for asthma. We did 30 community-based interviews in partnership with the Yellowknives Dene and the Kagatu First Nation, and the themes that emerged were ones of isolation, anxiety, reduction in physical activity, irritation, a feeling of what does this mean for our children? But the theme that I love the most, and I want you to take from this presentation, is that the people who prepared the most, who knew what the evacuation plan was, who knew how to get there with their family, who prepared an evacuation kit, who helped their community line up boats next to the river in case the highway got blocked so that they had an alternative means of escape. They sat up straight in their chairs. They spoke with pride in their voice, and you could tell that this for them had been part of the reason that they were alive. Everybody wants to contribute. Okay? So what we learned from that is that preparation not only does good, but it feels good. So this ecological grief that we hear about, we can treat that with preparation. Not knowing the plan, the worst moment when a trauma patient is rolled into the emergency department is the moment where you eyeball them, you can see that they look sick, but you don't quite have a diagnosis and you don't have a plan. The minute you name the diagnosis, you make a plan, you assign items of action to the people in the room, and you ask them to report back to you when it's done, that's the moment the tension in the trauma room goes like this. That's the moment we're looking for right now, okay? Many people have experienced smoke this summer in a way they never have before, so many people are feeling like this. We need to entirely reframe the way we look at health in order to fix this. So it turns out that the complex self-regulating system that we walk around on every day is not an environmental box that is to the lateral side from health, but is the essential underpinning of health and health systems. These are the planetary boundaries. You can think of them as the Earth's organ systems. The two core ones are climate change and biodiversity. This measures how far they are out of the safe operating zone. They are distressingly outside of the safe operating zone. So this is what we have to manage now. This ecological determinants of health, that's the platform, that is the foundation of our planetary health nest. It is becoming unstable with extreme weather, soil loss, water shortage, and more. So on top of that, we're seeing more patient presentations, as Catherine was talking about. So heat-related illness, wildfires, asthma, infections, malnutrition, and potentially the risk for increased conflict and migration. So with all of that, we're also seeing changes in our social and structural determinants of health. Okay, housing damage, threats to livelihood, education and training disruption. One thing I really want everybody to think about is supply chain disruption. We already have a crappy drug supply system. That is not going to get better unless we change it. I believe we need domestic supply. I believe that probably needs to be done either by a crown corporation or some other purpose-driven corporation. We can no longer hand over a perfect planet to the doctors of tomorrow. We can hand over a stable drug supply. okay? And we need to start that now. So when we think about how we're gonna do that, we always think about health, and I wasn't taught advocacy in medical school, so when as I said, when I first learned about the problem with climate change, I just told everybody, climate change is a big health problem. And they were like, because that's not actually a way to get things done, okay? You need to be very conscious that this health problem is as a result of power problems, okay? And the corporations that we're gonna need to be aware of and out lobbying essentially in order to achieve a safe and healthy future include pharmaceuticals and medical devices, ones related to food and agriculture, fossil fuels and energy, transport, and healthcare. Okay, there have been coalitions aiming for secure drugs, and we need to revamp that post-pandemic. Now, so this is our adaptation sprint. You need to really understand that we are not at a new normal. Canada is going to continue to warm until probably the end of my practice lifetime under all feasible emission scenarios, okay? So when you sit down with the engineers and design your next hospital, you need to have the temperature and precipitation projections for your community on the table so everybody understands that you're building for the weather patterns that you're going to have, not the ones you just had. And that is gonna be sometimes an uncomfortable position. People might not wanna hear it. Okay? When that happens, I want you to picture all of the other physicians all around the world who are sitting there as the lonely voice at a table, saying something that's a bit scary in service of their patients. Okay? I know you can wake people, you've woken many people up in the middle of the night. This is just sort of an extension of that. Canada's national adaptation strategy has been published. We need to dive right in. And of course, there are inequality-related risks that are intertwined with this that really increase the risk of substantial systems collapse. Now, mitigation sprint. This, I believe, actually is more fun. So, tipping points. A critical threshold beyond which a system reorganizes, often abruptly or irreversibly. This includes the climate system, bad tipping point. Clean technology, good tipping point. Mainstream and planetary health in the health sector, good tipping point. Now, this is why we work as fast as we can. We have graphs, we have politically determined outcomes, but the only thing that matters is the complex system that is the Earth. Just like people, it has positive feedback loops that can be triggered. That is what we do not want to happen. So these wildfires that are happening in Yellowknife right now worry me because they are all emitting greenhouse gas emissions and probably methane from the permafrost. Those have the potential to be starting a positive feedback cycle that will lead to further warming, okay? Many articles point out that we can actually trigger tipping points between 1.5 and 2 degrees Celsius. We don't want to get to the 2.5 degrees Celsius, okay? This is why we need near-term targets. Now, we have all the opportunity in the world. Clean energy is coming down. The only thing is there's sand in the gears because we're still subsidizing the wrong thing. We're subsidizing fossil fuels. This is ridiculous. This is a result of fossil fuel-related influence. We need to out-lobby them. Problems with power, all of this is leading to more inequalities with Indigenous populations being really disproportionately affected. So this, this is a call to courage.
We must move rapidly to a low-carbon economy, even before I die. Some people find this uncomfortable to hear. How do you feel about it?
The days that move a little faster than light, and I see that the feeling is right. Gotta tell what I feel in my heart, and I love you. Wake a little more every day. But the leaves, they blow and decay. While I grow a little farther from you. Well, I see your path, see your light. Need a little push to erase.
So that was a video I put together with my community when we were feeling ecological grief. And the reason I think it's so important to acknowledge and attend to that is that if we don't attend to our emotions, they rule us. And we kind of shy away from things, okay? So give yourself the space to attend to those. It's really important we do in particular because we are some of the most trusted people, and that means we have the most ability to affect change. We have reason to, about 1 in 5 global premature deaths are attributable to fossil fuel related air pollution specifically. We're responsible for 5% of greenhouse gas emissions, and we allocate 10% of global world product, okay? That's cool, as a global health sector. So the general plan for planetary healthcare is we need to reduce demand for health services, match supply of health services to demand, and then reduce emissions from the supply chain. This will happen iteratively. You pick a target at either a micro level, so individual level, meso level, which is institutional, or macro level, which is subnational. You assemble the team required to get that done. You tell stories that speak to people's hearts. You win that thing, and then what happens is people notice, like with the coal power phase out, and they join in and they want to do it too. Okay, so any interaction, I want you to be thinking about the head, the data that drives your target selection, the heart that informs the story you're going to tell to move people to actually do the work, and the hands. What are you going to actually ask them to do? Because otherwise they're just going to be sitting there one step down the chain not knowing what to do. These are some key things. We assembled a multidisciplinary group from 6 continents to say, okay, well, what are the highest impact targets that we can do in order to create these tipping points? Number 1, publicly commit to incorporating this work into your scope of practice. There's good evidence from the social sciences that that's very powerful, particularly if spoken aloud. Divesting, shift your money. Calculate and reduce your carbon footprint. When you do that, not only do you reduce the footprint yourself, but you send ripples of influence off into every direction. Your influence is irreplaceable. I can't exert the same influence that any one of you can on your friends and family. Those social norms change fast. We need to, in Canada, follow the leadership of the UK. And I just wanted to tell you how we ended up signing up for the COP26 health program. Nick Watts, who's a friend of mine and is the annoying kind of friend who's inspirational and always does things better than everybody else, showed up at COP26 with a zero emissions ambulance. He's in charge of decarbonizing the NHS. So what happened was we were all walking back and forth through the parking lot looking at this shiny ambulance, and we were all under the gun to get our country signed up to the COP26 resilient low carbon health system scenario. And what happened was the US, mid-COP, decided to sign up. So all of a sudden, Stephen Guilbeault starts to be under the gun. All of the other environment ministers are under the gun. And by the end of it, 61 countries, or 50 at the time, now 61 countries have signed on. So just as somebody who comes into the emergency department and is sort of complaining, that's catching. Good behavior and leadership, also very contagious. That's what we're aiming to make happen now. Right now, we need a quantitative plan like this. We have no plan. We can do math in Canada. We can do this. We need more support. They have about 170 people working on this in the UK. We have a handful. Okay, we need to shift our resources. We need to make sure that our supply chain is aligned with what's happening in the UK and the US. Now, how is this going to help right now? This is going to make our lives better right now. So we shift to solar panels. Those are actually catching. They're also viral. Decarbonizing our transport and electricity not only starts to make our healthcare institutions, if we're connecting our solar panels and we're making sure that our bike lanes connect to our healthcare systems, those become anchor institutions of sustainability in our community, and they start to become examples of best practices. That is catching itself. We need to embrace Indigenous wisdom. They're the experts on this in Canada, and many, many sensible initiatives like the Arctic Indigenous Wellness Foundation can show us how to do work that is very planet-centered. We have wonderful Melissa Lamb who's going to come and show us how park prescriptions can be very, very powerful. And when we do that, we start to enhance our ability to protect the natural systems. That decreases the urban heat island effect when it's in an urban area, reduces noise pollution, reduces air pollution, and also increases the habitat, allowing space for other living beings and preventing the risk of further viral transmission and future pandemics. Decreasing air pollution reduces mortality from the 5 chronic diseases that kill Canadians the most. Plant-rich diets, Very important, Jane Philpott showed us how it's done by standing up to industry and giving us a totally evidence-based food guide. This can be done at the hospital level with therapeutic gardens that have actually been shown to be really, really wonderful in all sorts of treatments. So now our world is starting to look different, right? We're starting to look like a healthy planet that is going to be better for people. Empowering women and girls through access to education and sexual and reproductive health care decreases mortality, increases educational attainment, increases women's power within the families, gives them the opportunity to become decision makers. And bodies that have an increased proportion of women in them make different decisions. They support health, they support social services, they support education and the environment. So, look, this is starting to look better. We need to move away from the super pollutants in healthcare in inhalers, as well as in desflurane and some other gases. Get rid of our gas-fired stoves. Hey, you want to live in this place? I want to live in this place. So we have had some incredible leaders in Canada. Health has contributed to this already, helping to phase out coal in Ontario and achieving coal-fired power commitments in Alberta and in Canada. I was honored to speak at the launch of the Powering Past Coal Alliance, and we now see this happening all around the world. So at COP27, more than 500 organizations from around the world representing 46 million doctors and healthcare professionals asked our decision makers to treat climate change like a health emergency. Last year, we organized a call for a sign-on to the Fossil Fuel Non-Proliferation Treaty, got so many doctors to sign on that the WHO signed on, and that paved the way for the European Parliament and multiple countries to sign on. So we're already having an impact at a macro level, and most of us aren't even briefed. Imagine what we can do together. So you're here right now, and that's scary. But this is where we're going. We're gonna shift practice, we're gonna shift money, and we're going to shift power, and we are going to deliver a cheap transition that ensures a rapid, healthy, low-carbon transition, and we're going to make it inevitable. So thank you for your support of my territory. The way you can thank us the best is to make sure that your home is prepared and to be courageous and show leadership in decreasing greenhouse gas emissions through the work that we all do in healthcare, to make sure that that is healthcare that is done without harm. And when you think about it, this gives us the chance to help not only every patient we will ever treat, but every person yet to be born. What you do matters. Thank you. Went over time.
Thanks so much. Thanks so much, Courtney, for an informative and inspiring presentation. Like Catherine, your commitment to this issue is, it shows the way to all of us. So thank you for that. And I know that this is a particularly difficult moment, a particularly difficult day for you. So to be able to deliver under that kind of duress is very, very impressive. So thank you. Thank you so much. We're now going to invite 3 physicians to join us for a panel discussion. And a note that we're going to be taking questions for all of our panelists in about 20 minutes. So feel free to start posting those questions to the app as we move through this conversation. Dr. Stephan Williams is an anesthesiologist at the University of Montreal Hospital Centre, or CHUM. He is a medical co-manager for carbon neutrality, sustainable development at CHUM, and is part of a team tasked by the hospital to make it carbon neutral by 2040. Stephan is also a clinical investigator at the CHUM Research Centre, a clinical assistant professor at the University of Montreal, and chair of the Carbon Neutrality Committee of the Association des Anesthesiologistes du Québec. Dr. Melissa Lem is a Vancouver family physician and president of the Canadian Association of Physicians for the Environment, or CAPE. She is an internationally recognized leader in the field of nature and health, and has engaged in advocacy and policy work on issues ranging from climate change and hydraulic fracturing to sustainable healthcare and low-carbon transportation. Melissa is director of PARX, Canada's National Nature Prescription Program, powered by the BC Parks Foundation, and is a frequent media contributor on climate change and health. Dr. Ojistoh Horn is a Mohawk Haudenosaunee woman whose mother is from Ganawake and father is from Akwesasne. A family physician in Akwesasne, she cares for people through all stages of the life cycle and focuses her time in outpatient clinics, homes, and long-term care facilities in the community. Ojistoh is board member at CAPE Board, where she focuses on the effects of the environment and pollution on health and promotes the inclusion and support of traditional knowledge and ways of being into a framework for providing holistic and primary care to her people. So welcome to all three of you. Thanks so much for joining us this afternoon. And Stephan, I'll let you kick off the discussion.
Oh, well, thank you for the introduction. Thank you for having me speak here. And also thank you to the speakers that just preceded me, because they really cleared the way for what I have to say. Now, I had to wait for my conflict of interest slide. Here it is. I don't really feel that I have a conflict of interest in this talk, and I do not have financial support. Now they say if I press the forward button, I will be able to get my slides very soon. So let's wait for it to load. The one good thing about this waiting is that my time is not going up, so I still have 7 minutes to speak to you. Here we go. So the title of the talk is Climate Crisis, Health, and Net Zero Care, and you've heard about me. Let me tell you a little bit about the teams I work with. The first big team is the CHUM. It is the biggest and most modern of all Quebec hospitals. 18,000 people work there every day, and we have almost 1 million patient visits per year. And since December 2021, the board of directors has added to the institutional mission to aim for net zero greenhouse gas emissions by 2040, with no compromise to levels or quality of care. And I also work with the Association des anesthésistes du Québec, which represents every anesthesiologist in the province. And we're part of a bigger movement in anesthesia to improve care while greatly reducing greenhouse gas emissions and cost. There you go. My opinions are my own. And the reason we're doing all this, well, you've heard it all already. We are in a climate crisis. This climate crisis is the main threat to human health. And as the IPCC keeps telling us, we already have all the solutions we need to get out of this climate crisis. So what are we waiting for? We're not waiting anymore, we're doing it. So solving the climate crisis, it means getting to net zero greenhouse gas emissions as soon as possible. I know net zero, people don't really know what it means. It means we're not emitting any more greenhouse gases than we resorb, which is not what we're doing now. A net zero future is good because it's, first of all, it's achievable. Secondly, it improves security, health, and quality of life. And finally, it results in big dollar savings versus the status quo. How does this apply to healthcare? Well, as we've heard, healthcare is 5% of Canada's greenhouse gas emissions, is 5% of the world's greenhouse gas emissions. To give a point of comparison, it's a lot more emissions than air transport. And just our hospitals are emitting a lot more greenhouse gases than all of Canadian domestic air transportation. So it's a lot. And right now, we're in a paradox where we're building the patients of tomorrow with our care of today. And that's what we feel we need to escape from. So where do these healthcare emissions come from? Well, we've spoken about it a little bit. You know, you do a greenhouse gas audit, and you find that we have both a lot of direct emissions, which are mostly caused by our use of fossil fuels for heat and transportation, but also medical hotspots like anesthetic gases. And then we have a lot of indirect emissions that come from the whole value chain of purchased goods and services from creation to disposal. And this is a nice way of seeing things, because when you look at all the waste produced by a single major oncological surgery, You see, it's not just dollars, it's not just a lot of stuff going in the garbage, but it's also a lot of avoidable greenhouse gas emissions. There's obstacles to net zero healthcare that we're meeting, but the biggest one is that neither caregivers nor admin have been trained to consider greenhouse gases in their decisions. So all these hospitals and systems have not been designed, and most of them are not aiming for net zero yet. And the solution is to just stop avoiding the climate crisis. You know, it's not fun to think about this, but it is fun to be solving it and to be integrating net zero into healthcare culture, sure as individuals, but mostly group values, group actions, teaching, purchasing, procedures, medical guidelines. The new Canadian Anesthesia Society guidelines are a great example of that. And finally, into our rules and our laws. We don't need to start from scratch. We've heard about the NHS. They've basically created this list of things to do, and if we do them, we will have a net zero healthcare system by 2040, 2045. Now, on the list, a great example is anesthetic gases. Now, anesthetic gases are a medical greenhouse gas emissions hotspot because some of them are also very powerful greenhouse gases, and all of them are ventilated unchanged into the atmosphere, where they persist for years, decades, or centuries. Now, it doesn't have to be this way. Equal or better care is possible without using high global warming potential anesthetic gases at a lower cost. And to give you the shim example, well, we've changed our practice, we've improved our anesthesia over the past 7 years, and we've reduced our greenhouse gas emissions by over 95%. This is thousands of tons less going out every year. And this has come with cost reductions of over 80% in anesthetic gases. And we've been able to reinvest this money into improving care. So our anesthesia is better than before, it's cheaper than before, and it's emitting a lot less greenhouse gases than before. Well, that's good, but for anesthetic gases and everything else, systemic results will only arise from systemic action. So when the AEQ looks at a group of Quebec hospitals, we see three things. We see a few doing even better than the shim, and they've really taken this message to heart and reduced their greenhouse gas emissions. We see a lot of hospitals where things have not changed, and greenhouse gas emissions or costs are not being considered their anesthetic care. And we even see a few hospitals leaking nitrous oxide, which is a powerful greenhouse gas, but a weak anesthetic, directly into the atmosphere without it participating in patient care, just because, well, why not? That's the way it is now. And if you contrast this to a country where getting to net zero in healthcare is the law, well, you see that in the UK, high global warming potential gases like desflurane will be decommissioned by next year. So by next year, every hospital in the UK will be like the best hospitals in Canada. So I think that is a great result. We've talked a little bit about pressure meter dose inhalers. Here, the problem is the propellant gas, not the medication. The CMA is actually part of a group of associations asking ECCC and Health Canada to create a timetable for the removal of these high global warming propellants in Canada. Fossil fuel pollution, obviously, the shim is a brand new build, and we've landed on the Canadian map of large greenhouse gas emitters. And this, despite experts from inside and outside telling us it really doesn't have to be this way, and it is a lot more expensive to be doing things the way we do it. The return to reusables, obviously a lot less greenhouse gases, a lot of other positive planetary health impacts, and a big plus to our supply chain because it's a lot harder to disrupt things that you reuse. Eliminating zero-use material, this is a plague in medical procurement. All this stuff, we buy it, we don't use it for our patients, we throw it away, it costs a lot. So I could go on all day, but I won't. I'm going to summarize. Big reductions in healthcare emissions, they will result in improving patient care. They're not a question of money, and they are technically feasible. We need to create this culture where people accept the right goals, which is zero, the right timeline as soon as possible, and the changes we need to make to reach them. And a net zero Canadian healthcare system by 2040. First of all, it's a geophysical necessity. And second of all, it's a pragmatic contribution to the return of climate security. It resolves this paradox of creating the patients of tomorrow with our care of today. Action is needed at the highest levels. Yes, goals, yes, measurements, but I'm going to say the same word in the same sentence twice, action. And these actions are a great opportunity to innovate, to spread knowledge, reduce costs, and improve care. So that's the end of my part. Thank you.
Thanks so much, Stephan, for your presentation and for your brevity as well. So thank you. Thank you. Melissa.
Thank you, Adrian. So in accordance with CME accreditation requirements, I declare the following affiliations. I've previously declared the following affiliations. I guess I have to wait. Oops. Okay. Do I just keep going to my next? I'm waiting for my slides. So while I wait for my slides, I just want to tell you that I was incredibly inspired by all three of the speakers that we just listened to today. And I knew that Dr. Howard in particular, who's been a friend of mine since residency, would be giving us this rallying cry. So what I wanted to do was to give you a chance and to give you a window into some of the initiatives that you can get involved in today to start working on these planetary health issues. So number one is my first love, nature and health, which has been mentioned. I'm the director of park prescriptions for the BC Parks Foundation. And this is a province-wide, well, actually Canada-wide initiative in every province in Canada, where if you are a regulated health professional, you can literally prescribe nature to your patients to improve their health. And the reason why this is a very kind of powerful but insidious planetary health initiative is because when you prescribe people to nature and connect them to it, not only do they become healthier and more resilient, there's a huge amount of research showing that almost across every single health condition, that spending time in nature is one of the best things you can do for your health. But when people are connected to nature, research tells us that across the lifespan, they engage in more pro-environmental behaviors beyond just conservation. So they tend to recycle more. They tend to save more energy. They tend to vote for climate advocates and engage in more climate action. So I like to think that every time one of the currently more than 11,000 regulated health professionals across the country who's registered in our program prescribes nature, that they're doing something for the planet at the same time. And I also want to underline the importance of collaboration in reaching our goals. So this is something that I could not have done by myself as a family doctor when this first hit my radar. We're talking over close to 15 years ago now. It was collaborating with the BC Parks Foundation, collaborating with a parks organization that specialized in public engagement, which is the way that we got this across Canada. So on this graph, you can see that we launched nature prescriptions in Canada, well, in BC first in November 2020. We grew to about 1,000 prescribers after a year. But it was when we announced our collaboration with Parks Canada at the beginning of 2022 that our numbers really took off. There are two reasons for this. One was now that prescribers could prescribe something that would reduce a barrier to access to their patients to nature. And also we received international and national media coverage. So I think the statistic says that we have had over 200 international and national media pieces created about our program and the health benefits of nature. And we have had over 6 billion media impressions, reached over 6 billion people around the world with this message. And we just keep growing and growing. And I will mention that our prescribers include over 5% of all physicians in the country. There's research showing that when you hit 3.5% of a population engaged in a movement, that you hit a tipping point and it's going to be successful. So I think we have started to reach that tipping point, but are always trying to move forward. I also want to talk about my second love, which is the planet. And I want to admit something, which is that nature and health was a really safe space for me. For the longest time, I was avoiding the climate change discussion. Courtney actually, for many years, was saying, Melissa, you got to get involved in this. This is the biggest health problem of our time. But it was scary. But it was through connecting with people in Cape, BC, with seeing the amazing work that Courtney was doing, that gave me courage and to embark on climate change work. I'll go into that a bit more later. So there's currently a committee in every single province in Canada that you can connect to of Cape, where you can work on these planetary health initiatives. And again, Where we've had the most success is when we have collaborated with other organizations. So we've had campaigns to ban fossil fuel promotion in schools. We've launched local climate solution fairs to engage the local population decision makers, and we always try to zero in on what's going to make the biggest difference. In BC, it is the fracking and natural gas industry that is going to make us blow through our climate targets. And so we focused a lot of our advocacy around that, but always in collaboration with others outside the healthcare system. And I just want to tell you a little bit about my story, about how I got into this work. So I mentioned nature and health is my first love, but the moment that I really started to embark on this journey was when I had my own nature deficit experience. In moving from northern BC, which was my first job as a rural family doc, back to Toronto, where I was born, and suddenly moving from trees and bears and rivers and mountains to concrete and glass and skyscrapers, and feeling like I wanted to jump out of my skin, but not really knowing why. But I remember standing in front of my window in my apartment in Toronto, looking out at the little square of sky with the CN Tower, and thinking, you know why I feel like this? I think it's because I'm missing nature. And so, like Courtney, my nerdy self sat down in front of a computer at that time, did a lit review, and hundreds of studies popped up about the health benefits of nature that I had never heard before or learned about in medical school. And I thought at that moment, close to 15 years ago, I have to make this my mission to communicate this to the public. And so, look where we are today. My motivation, though, over and above connecting with people in Cape to get into climate change work is my son. So this is my son when he was 3 months old. My husband was teaching in Montreal at the time, and I thought, you know what, I'm stuck on my butt breastfeeding for hours and hours per day. Might as well start reading about climate change with my son on my lap. So I started reading Naomi Klein's This Changes Everything, which is an amazing book about climate change and capitalism and how they interact. And the scales fell from my eyes. My eyes were open and I couldn't unknow anymore. And from that moment on, when my son was 3 months old, I thought I have to get into Boulder Climate Action. That is him at about 5 years old after receiving a signed copy of How to Change Everything from Naomi. Something I do want to mention, though, in the context of what Courtney talked about was that I was supposed to go to Yellowknife this Saturday. In fact, until yesterday afternoon, I thought that I was supposed to go work there because I booked a locum there for 2 weeks, months ago. And so as I was going out the door with my 8-year-old, he had packed an emergency kit for me. And I literally took my engagement ring off my finger and said, I don't want to bring it to Ottawa because I'm heading to Yellowknife in a couple days. And I will never forget the look on his face of sadness, of fear, and of courage as I was pulling away in the cab. And right now, there are families across this country, in the Northwest Territories, in BC, that are being evacuated and have had these life or death moments, are fleeing for their lives. And to be very honest, I am getting incredibly tired of sitting in rooms with decision makers and hearing from them over and over and over again, we can't do what you're asking because we don't have a public mandate. This is not what the public is asking of us. So what I want to do is give you a framework where you can, so I'm talking individually, but also organizationally, so CMA, I'm looking at you, in terms of how we can all move towards our bespoke ideal climate action. So number one, this is a framework that has been created by Dr. Anna Elizabeth Johnson. It's based on the Japanese principle of Ikigai. You want to think about what you're good at, what your special skills, networks, and resources are. You want to think about what brings you joy. For me, it's nature, my family, my community, what gets you up in the morning, because this is both a marathon and a sprint. And then you want to think about what the work is that needs doing. Where are the gaps in our systems? You don't want to create your own new NGO or your own environmental group because there are enough out there. Join one that exists and contribute to them and draw resources to them. And in the middle of all those three is where you will find your ideal climate action. And so that's what I want you to think about today, is what are you going to do when you walk out of this room? What climate action are you going to take within your organizations and individually? Because this is the epic fight of our lives for a livable world. And I invite you to join us, whether it's through prescribing nature or joining a CAPE committee or in your own communities connecting with others. Join us in this journey and this quest towards a healthy future. Thank you.
Thank you so much. Thank you so much, Melissa. And Ojistoh, you can tell us about your work in this area. Thank you.
Oh, that's what I look like. Okay. Okay, so these are my, my conflicts of interest. I don't have any. I am part of the Canadian Association of Physicians for the Environment on the board, as well as the College of Family Physicians of Canada on the Indigenous Health Committee. I'm on the board of the Federation of Medical Women of Canada, and I'm very happy to be here today. So, I don't have any financial disclosures. I think I have to wait till my slides come up. Okay, so good afternoon. I am so honored to participate in this very important discussion. Today I will describe how Indigenous concepts and experience can inform the discourse regarding the net zero healthcare goal in Canada. I come from a very political and traditional-minded family. As Indigenous people are diverse, I can only speak about the protocols of my people, the Ganyak-Gahaga, also known as Mohawk, of the Haudenosaunee Confederacy. My mother is Bear Clan from Kahnawake, and my father is Wolf Clan from Akwesasne. I've been working for 15 years as a family physician in both communities, as well as in the nearby secondary hospitals. Recently sitting in the Longhouse, listening to the words said over the body of our recently deceased war chief, a beloved, kind, and incredible knowledge keeper, I was reminded that I'm a small part of a greater energy needed to awaken the people. To be awake is to be able to fulfill our obligations and responsibilities as stewards of this earth. So what does it mean to be a steward of the earth? We have a Thanksgiving address. It's called the Ahondo Gariwadekwa, or the words that come before all others, where we acknowledge being part of creation, have been placed here on earth to mingle with each other peacefully, supporting creation to thrive. Everything on earth came with its own original instructions, and everything has a right to carry out those instructions. We could call it DNA. We recognize the great balance, the great homeostasis, the great reciprocity, and it's our responsibility, our moral imperative, to take care of the surrounding lands, waters, and ice, and all the plant, animal, insect, and fish species that they contain for our and future generations. There was a time about 1,000 years ago when we forgot our instructions, and we were constantly at war. Through the teachings of the Ganawida and Hiawatha, we accepted to work together in a strategic way, keeping the peace, making decisions with our minds and not our emotions, eliciting the help of those who could affect change, and thinking of how our decisions would affect the future. These rules for engagement are called the Gayernic Goa, or the Great Peace, or the Constitution of the Haudenosaunee Confederacy. Today, we've been unable to fulfill our original instructions. The earth is not balanced. We are back in a time of chaos, and we must make difficult decisions about our way of life and the future. The health of Indigenous people is not robust and only partially explained by the social determinants of health. Is our health also impacted by our inability to be effective stewards? We've tried to protect the lands and the waters. We try to hold governments and institutions accountable to their own laws. And when we've tried too hard, there's been pushback. We are gaslit. We've been characterized as terrorists and troublemakers. And some have even been jailed or killed for defending lands and waters. Is there moral injury because we've been ineffective stewards? Would we be healthier if we could fulfill our moral imperative to the earth? Is this why land and culture-based programming has been so acceptable and successful in achieving healthy outcomes in our communities? There are upstream and downstream approaches to analyzing problems. Money is typically put into downstream programming. It doesn't affect upstream factors, and outcomes revert to the status quo. Most upstream, we should always ask, what is the prevailing worldview of the society? And then, what rights support this worldview? Followed by, what are the laws, declarations, treaties, and acts that the society endorses to support these rights? And next, what are the institutions that have the mandate to fulfill these legal orders? And what are their rules, responsibilities, policies, and procedures? And then, what are the programs provided, and what outcomes are measured by these institutions? And finally, how do individuals, businesses, communities, and NGOs of the society hold institutions accountable to those mandates? Despite the immense budgets of Indigenous Services Canada, why is our health so poor? When most of the resources that Canada extracts is from unceded Indigenous territories, why is there so much poverty? Institutions have upstream instructions embedded in their mandates, which have allowed for the last century of abuses endured by Indigenous people. The answers to how could these happen and how can we fix it are found upstream. So let's look upstream. This year in Canada, the amended Canadian Environmental Protection Act recognizes the right to a healthy environment. And this is a game changer because it recognizes the moral imperative to protect the environment. However, how will the right to a healthy environment be weighed against the rights of corporations? Robin Wall-Kimmerer, the author of the groundbreaking books Braiding Sweetgrass, shared the following statistic. In a large group of children, most could identify over 100 corporate logos, but could only identify 10 plant species, illustrating that we recognize those things in our immediate environments, and sadly, society is subsumed by the corporate one. I would invite everyone to read the Lancet series published in April of 2023, this year, about the commercial determinants of health. Biodiversity is a buffer supporting a balanced climate. At the United Nations COP15 meeting in Montreal last year, the goal was set to maintain 30% of the Earth's biodiversity by 2030. However, 85% is presently stewarded by Indigenous people. After centuries of indifference, we are being asked to help find solutions, such as the managing of our fisheries and forests. But our communities are impoverished. We are not always compensated, nor do we trust sharing our knowledge. Our knowledge and ceremonies are commandeered and filtered into the burgeoning wellness economy. The economies available to us are the procurement of local natural resources, waste management, and the selling of products that bring people to spend money: casinos, gas, cigarettes, cheap alcohol, and cannabis. And there is human smuggling as well, which is expected to increase with climate change-mediated migration. With few options, many groups have made relationships with large corporations who are indigenizing their promotional material to morally justify their works. None of these correlates with our worldviews, provide safe and sustainable opportunities for the future, or will improve our health. Thinking strategically requires looking upstream at prevailing worldviews and recognizing how the economy and misinformation inform our decisions. We must support the right to healthy environments and empower institutions to align their mandates and programs accordingly. We must include cultural and land-informed ways of connecting everyone, including our neurodivergent children, differently abled, and the elderly, supporting ways to safely spend time outside and reestablish society's relationship to the earth. We must improve our chances of finding solutions that prioritize the health of the earth over that of the economy. Nyao goa.
Thanks so much. Thanks so much, Ojistoh, for that deeply informed presentation. Thank you. It's now time for your questions. And if possible, please specify which of the 5 panelists you'd like to answer your question. So I think we'll start with the in-person audience here. Is there someone out there who with a question? I'm not seeing anyone yet, because we do have some online. No questions? Okay. There's a question from Shazma Matani online that says, what can PTMAs do to lobby for and specifically support climate action? I live in Alberta, where fossil fuels are still very much invested in, with a very climate action reluctant government. The climate change denialism is strong. Courtney, do you want to take a stab at that?
Sure. So when I'm thinking about decarbonizing healthcare, I've spent a lot of time analyzing the organizational structure that they have at the NHS in England. And as I said, they have 170 people working on it, and they are partly connected to Scotland and Wales. But we have a slightly different structure because healthcare is delivered provincially. So what I would suggest that would be very helpful and also probably elicit a little less fire would be to lobby your provincial health services to create a secretariat to help coordinate the decarbonization of healthcare services in Alberta. And I think that that initiative has started. So if there is one, make sure that you continue to go pester those humans and make sure that resources are adequately allocated, because really, in order to get this done, the reason this is working in the NHS is because they have leaders at every single level of the system, and every single level of the system has a plan. And so it just makes it easier for everybody to move in alignment. So I think I would probably start there. As someone who lives downstream from you, if you feel like doing something a little more potentially fiery, we really need the tailings ponds not to all get dumped into the Athabasca River. That is kind of what industry is starting to indicate. They're saying, look, we might actually have an overflow due to severe weather as a result of climate change, so it's just safer if we sort of gradually dump these into the Athabasca River. And they're toxic. Right now, they're double the size of the city of Vancouver. All of the communities, mostly downstream, are Indigenous. It's an issue that they've been asking me about since I moved there 12 years ago. They've been asking for a peer-reviewed study into the current local health impacts. We haven't done it. So anything you can do to increase research and to put barriers up to those practices, we would be deeply, deeply, deeply grateful for downstream.
Catherine, I know you want to say something.
Yeah, I mean, as someone who's in government, I mean, people always think, like, why doesn't government just do the right thing? And there's some real challenges, and government absolutely needs to show leadership. But government also needs pressure and needs support, positive support, because there's a lot of folks lobbying all the time against it. And it's obviously really tricky with Alberta, because we need to worry about people having jobs. 100%. Like, we're not going to get climate action if people don't have jobs. But there are huge opportunities in the clean economy. The number one thing that has to happen, so this is at the federal level, is a cap on emissions from oil and gas. That has to happen. We cannot meet our climate plan, our 2030 target, without a cap on emissions. Oil and gas is the largest source of emissions in Canada. It's 26%, and their emissions continue to go up. And that doesn't mean we don't care about jobs. Just transition and thinking about workers and communities is important, but we actually have to do the work. And the challenge is right now, and this is where I know it's always like not nice to say, like, don't love fighting. People are like, wow, you're just such a fighter. Well, the reality is fossil fuel companies have made obscene profits because of an illegal war. Not because they're brilliant, because of an illegal war. What did they do with those profits in the face of climate change, in the face of renewable opportunities, is they've actually given the money back to shareholders who mostly aren't Canadian. And they've given executive compensation, and then they've invested in new fossil fuels. So just being very practical, there needs to be pressure on the federal government to actually get this cap, support for them positively to do this, because a lot of folks are like, don't do that. The most consequential thing that we need to be doing, and everyone has to do their part. I think it is important to bust some myths. Melissa was great, Dr. Lem was great. Like, Canada's the largest per capita emissions in the world. So if everyone emitted the way we do in Canada, and it's not that we individually are doing it, it's because of the oil sands, transportation, but largely the oil sands, then we would have blown our carbon budget like everywhere. So the thing is, we need to do consequential things. They're hard, but the support I saw from doctors when it came to carbon pricing and when it came to coal phase out was extremely powerful and important, and linking it to health.
Okay, thank you.
I want to add something,
we have a quick
possible, Adrian, to this conversation. So I know we all know about the political situation in Alberta, but something that I found in meeting with decision makers all over the place is that everyone is on board with adaptation. So it's totally true that we've gotten past the point where we can just mitigate and everything will be fine in the future, but we have to start adapting. And so if you can frame the changes that you want to make through your PTMA in the adaptation frame, but at the same time, while you're adapting, make sure that all those adaptation measures are mitigating at the same time, like more green space in cities will absorb that water from flooding and shade us from extreme heat, but at the same time improve people's health. If we put solar panels on our hospital or geothermal, this will be workable in a situation where all the power lines are down, or, you know, I don't know, gas lines are cut or something. If you can start to frame, if you can start to think about how to bring mitigation into the adaptation conversation, especially in a government that's not as favorable to mitigation, I think that could be a way in for you as well.
Stephan, you look like you want to talk, but I have another question for you.
Okay.
Yeah, so this question is from Jamie Hudson.
All right.
Thank you for your contributions to this important topic. As was mentioned earlier, single-use products and the packaging for these products are a large source of waste in hospitals. I'm wondering what steps healthcare providers and the CMA can take to influence change in this particular aspect of waste within the healthcare system.
Well, that's a good question, and I think it ties into the last one, because when we talk about waste, especially solid waste, we reach people that are different than the people that are interested in the climate crisis. People are very sensitive to the solid waste and to the costs that are involved, and it's not the same people at all. Now, the CHUM emits 3,000 tons of solid waste a year and emits 23,000 tons of CO2 waste a year. So our biggest waste product is CO2, but people like to think about the solid waste a lot, and there is a CO2 footprint associated with all that waste. And if we bring it forward as a question of quality improvement, a question of cost reduction, because having less of this single use and less of this zero use stuff is also a lot cheaper. If we bring it forward as a question of resilience, and when we have these supply chains, I work in an operating room, and every week they're giving me different tools to do the same job, and that's not the best quality care. So if I had tools that came back always the same every time, I could do a better job than the job that I do now. So I think bringing these arguments forward lets you get agreement from people that are different from the traditional climate sensitive crowd, which is a small proportion of the people who are working in a hospital.
Okay. This next question is for Ojistoh and also Melissa, and it comes from Samantha Grills. What advice do you have for physicians and other healthcare providers who are caring for children and youth experiencing significant climate grief and eco-anxiety? Ojistoh, do you want to start?
So that's something that most Indigenous people have been dealing with for several centuries, because we've seen all of these changes that happen on our watch and in our territories, and have seen the pollution and the byproducts, the externalities of the commercial world that we live in. My community is surrounded by 6 industries, and we have incredible amounts of illness today with autoimmune cancers, diabetes, and so it's a really, really, really big picture. And I think that we've had this grief for so long that it has become just part of the way that we are. There's an incredible amount of demotivation and sadness in our community because you can't engage with the world safely. We haven't been able to eat fish reliably or safely in our community for since 1985. We haven't been allowed to grow food. So we have a huge food sustainability problem, and a lot of our culture was transmitted through, procuring food, and water was not safe for a long time. So this grief is not new; it's kind of old. But what we have found is finding safe spaces within the community to be able to participate with the water, with the land, and make sure we're not outside when it's really smoggy. That's part of it, is education and getting out there. Not everything is polluted and unable to. Our Earth is not completely, unhealthy. There are spaces that we can go out, and so really, it's getting out there. How do we mitigate it? We just have to start interacting with our Earth. We have to start having a relationship with her again. A lot of Indigenous people have ceremonies, and these ceremonies are not, they're not really very difficult to understand, because really what they're doing is reestablishing our relationship with ourselves, with each other, with our families, our community, with the Earth, and all of the different beings that reside on her and in the waters. in the air. So, so the ceremonies, we all have ceremony, and we kind of do that anyways. When you go outside and you are, awestruck on some hike and you see, a beautiful, scenery, and you're like, oh, that's so beautiful. That's a ceremony because you are once again, engaging emotionally with our beautiful earth. And I think we all need to learn how to do that again. So part of grief is getting outside and once again, reimagining a much healthier relationship with her.
Okay, just in the interest of time, I'm going to move to another question. Yeah, please, in the audience.
Thank you. My name is Ed Stravinsky. I was chair of the Patient Voice for the CMA. I have just a quick question. As doctors, what's your point on nuclear energy?
Courtney, do you want to start with that?
Sure. So we're at the point, if you look at the IP Intergovernmental Panel on Climate Change graphs, where we're out of really good options. So most physicians' organizations don't consider nuclear energy to be a clean and healthy source of energy. When I look at the other things that could potentially keep us below 1.5 degrees Celsius, which include carbon capture and storage, which so far, there's no reason to believe that that's going to work at scale for anything close to something that's cost effective, and also very scary geoengineering projects. And then I look again at nuclear energy, which we have been doing for over 50 years. We know the risks. Would anybody still want the waste next to their community? No. Have communities been exploited in the extraction of the material necessary for it? Yes, right? I would say I put it on the sort of best of the bad options list. Okay.
I hope none of my students are watching because I'm going to ask a double-barreled question to Catherine right now. Catherine, this is from Leah Stevenson, the first one. What are the barriers to stopping oil and gas subsidies, and how can we support overcoming them? And there's also a question from Gurpreet Singh Ranger. How is anyone going to persuade the Gulf states to stop producing oil and emerging economies to stop using it?
Look, part of all of this is entrenched interests. We've heard this, in particular, Indigenous peoples being on the front lines and, just having to take the impacts. And I think that that's really it. The reality is if we just approach this rationally, which drives me bonkers, I'm like, okay, we know the problem, we know the solution. It's very hard. And so I think in government, I think there's been some advances in addressing fossil fuels, but not enough. How on the one hand can you price pollution and then you give subsidies to the industry that you're actually trying to stop polluting? And so there's that's got to stop. It doesn't make sense. We can't be doing that. But there are folks that go in every single day. There's a lobby bot. You can go see it. I'm like, why are they going in? Why do they get access? Sometimes I tweet out oh, maybe the kids should go get access. Maybe they should go talk to some politicians and tell them how they're feeling with climate grief and what they want to see. So I think that there's that. And there's a whole history of that. I think there are real concerns around jobs, so that gets confused because there are great jobs in the clean economy. But of course, globally we hear this. You often hear from folks, often actually fossil fuel interests, well, you don't want to turn the lights on in Africa. And I was like, oh, that's really interesting because I've never seen a major oil and gas company say, my big focus is turning on the lights in a poor community in Africa. That's not a thing. Of course we need to be focused on that. But at the same time, these are the communities the most impacted. So that's why there's a lot of discussion globally on the money. We need to also be investing massive amounts of money to these less developed countries. Of course they deserve electricity. And with the Gulf states, it's like everyone. Everyone points a finger and everyone wants to be the last barrel. It doesn't work. We're all going to die if that happens. That's what's going to happen. We already have too much fossil fuel planned and happening. But I think that's the Paris Agreement. That's the whole point. We all have committed globally to do the part. So that's why it's so important that Canada does its part, because you can't call someone else out if you're not doing your part.
Okay. Unfortunately, this brings us to the end of this conversation. So thank you all for your questions. And to the panel, I've been to a lot of conferences, and I can't say that I've been to many conferences that have made me think and also feel in the way in which this conference has. And I think this panel kind of epitomizes that. I think that your collective commitment to this issue, which obviously is an issue that hits all of us And we're thinking about our children, we're thinking about the future, the existential crisis we're facing right now. Yellowknife is being engulfed, right? Kelowna is being engulfed. I just read online that the fire has jumped the Okanagan River, right? So this is real, this is now and real, and it's upon us. And I think that your engagement and your ability to kind of tell the story in the way in which you have has really kind of raised the level of the discourse, and is helping us hopefully to come to terms with what needs to be done in order to get over this mountain. So thank you all for your contributions, not just today, but many days prior to this and the days to come. Thank you very much to all of you. Thank you. So thanks to our keynote speakers. I'm going to make my way over to the podium as folks file off the stage. But thanks to our keynote speakers and to our panelists for opening our eyes to the climate crisis and our role in fixing it. And if you're interested in staying connected on this topic, the CMA has been collaborating on a climate and health communications project. Consultations on the work are being planned for this fall. Keep an eye out for a notification that will be sent via the conference app at the end of the summit that will link to a form where you can indicate your specific interests. Well, we've come to the end, nearly, of the summit. That wraps up day 2 of the CMA Health Summit, and I think it really was a very moving, very provocative, and really ultimately very inspiring finish, thanks to our panelists and of course thanks to you. We've covered a lot of ground over the last 2 days, hearing from experts, patient advocates, and people passionate about doing healthcare differently, working together to find common ground on issues like public-private healthcare, and hammering out ways to increase access for patients while improving working and learning environments. It's now my honor to welcome back Elder Claudette Commanda, who will close the Health Summit with a blessing. Elder Commanda. Yes.
Got to put on my old lady glasses. First, I want to begin. First, I need to say something. I need to give greetings from one of your colleagues, and especially to the Indigenous physicians. So greetings from Dr. Wesley Cody, my son. He says, "Mom, you're everywhere." Well, I said, that's me. Thank you for, wow, what excellent presentations that were given here today. I had the opportunity to listen in on the presentation on racism, and that was excellent, excellent points that were raised, and excellent points that were raised, realities from this panel with respect to climate, the situation of climate. So, chimi gwejonje, chiminotagaziwin, chimigwejonje, ki nibakawin. I thank you for those good words, and I thank you for the knowledge that was shared. Lived experiences, so thank you. I'm normally one that doesn't need to put down words what I want to say, but I had to make some notes. And I thank you for allowing me to share with you at this time my reflections of what I heard today in your health summit. It's very emotional, deeply emotional. These topics that were shared, it speaks about life, it speaks about people. It's not paper, it's not academia, it's not policy, that's for sure. It's people, lives, spirit, and it's very emotional. I wrote down words here of what I would say themes. What we do to nature, we do to ourselves. And we all have a responsibility to Mother Earth. We are in an extreme state of emergency. Mother Earth is suffering. She suffers, we suffer. And what world will our children inherit? And as First Nations people or Indigenous peoples, when we say 7 generations, everything and anything that we do, every decision we make today impacts those 7 generations that are not here yet. And that is why it's so critical when our people say, as the great spiritual leader Black Elk, we must return to the sacred hoop, the land and nature. And you have heard it here, this new, which is not a new phenomena, but is something that our people always had. The best medicine and the best healer was the land and nature. And every one of us, regardless of color, creed, race, where we come from, the Creator gifted us with Mother Earth, with nature, all of her creations, and we must take care of her. We must respect her because she is suffering. She suffers, we suffer. The children will suffer. Those creations, or that sacred hoop, it's life. And those 4 sacred elements of creation, Nibi, water, Nodin, wind, Aki, land, Ishkode, fire. 4 sacred elements that we need, those creations, and we must respect them. We need these 4 sacred creations in order for we as human beings, our 4 sacred elements of being, our spirit, our emotions, our mind, and our bodies to survive. The land is our medicine, and that is so important. And we must all return to that sacred hoop, absolutely. The presentation on Indigenous specific racism. Excellent points were raised. Change is needed, and we are starting to see the change. And we thank the medical profession for providing the space for Indigenous knowledge to be part and parcel to the swirl of medicine, to incorporate our lived experiences, our knowledge systems, which are land-based in spirituality, language, and ceremony, our medicines and our healing, validating and recognizing that we always had our knowledge system in place for medicine and healing. Blend those together with Western knowledge and just see the beautiful power that it has to give the best quality of life to people. When we bring together that knowledge of Indigenous peoples as well as Western knowledge, health, Minopomadzwin, to open your minds and your hearts and your spirit, your souls, to open to move away from colonial thought and actions, and to validate and recognize the importance of our medicines and our knowledge systems and who we are as Indigenous peoples to our families, to our communities, to our nations, to ourselves, that we are living that responsibility that the Creator and our ancestors entrusted onto us to share our wisdom and our knowledges. When you provide that safe space for us, this is what we call, or I call, reconciliation. Never mind reconciliation. Reconciliation is just a nice, warm, fuzzy, feel-good word. Talk about it and move on, and it's forgotten the moment you leave this door. Action, reconciliation. And you've heard it from the presenters here. It's a time of action, a time of action. We also, as Indigenous peoples, First Nations, whether we're Anishinaabe, Algonquin, or Hongo-Hongwe, or Deneta, or Ojibwe, or Lakota, no matter what our tribes are, we always had our ancestral traditional knowledges of the environment and conservation. As I said, when I had the opportunity to attend that meeting When Prince Charles was here and he spoke about the environment, I said, you call it the environment. We call it Mother Earth. We call it the land. You call it climate change. We still call it the land. The land is impacted. And when the land is impacted, the water is impacted, the animals are impacted, the medicine life is impacted. At the end, who fundamentally is impacted? We the people. We the people. So let's do what we need to do, that responsibility to our Mother the Earth and to all of our creations, from that water life, the plant life, the medicine life, insects, the animals. We're all interconnected. And that is so important that we have to acknowledge, recognize, accept, and provide that safe space for these knowledges to be part of the medical world. It is medicine. And the other message that I have here is validation. Not only for validation of Indigenous peoples, but when we say validation, it's to validate all of the doctors and the medical health and practitioners. And I thank you for the work that you are doing. You are those frontline workers. Thank you. And I know that many of you in this room, you were those frontline workers during the height of the critical time of COVID, right? Did you have a life? No, because you gave your life for people to be safe. I saw my son, what he had to go through every day as a doctor to provide for his patients, to ensure protection of everyone. But you give of yourself, and that's love. Love for the work that you do, love for the people that you serve. And as I said yesterday, and I'll say it again, hope is free and so is love. And use that love to continue building that hope, because you are a community of medicine people. Hope is free. Let us be the hope for tomorrow's generation. And I leave you, my brothers and sisters, with these closing words. To each and every one of you, continue doing that good work of who you are as healers. And when times are hard, and I know they will be, as they always have been, especially each and every day, that you continue providing the best of who you are as doctors, as health practitioners. And we all have those struggles. We all have those trials and tribulations. Resilience, validation, and a thank you. And as what the great Nez Perce leader, one of my heroes, Chief Joseph, he says, it does not take many words to speak the truth. And as what my grandfather, the late William Command, always said, human beings need to be validated. So from me, Claudette Commanda Anishinaabe Algonquin Ikwewag, from our women to each and every one of you, I say to you, my friends, colleagues, brothers and sisters, to you, the doctors, I say, Chimigwej, thank you for all that you do. Keep up the good work. And just remember, you have the 7 grandfathers walking with you. Call upon them, and they are there. They are there. They walk with you. Embrace those 7 grandfathers, the grandfather of wisdom, the grandfather of respect, the grandfather of courage, the grandfather of humility, the grandfather of honesty, the grandfather of truth, and the grandfather of love. And may the Great Spirit hold you in his loving arms, and that each and every one of you return home safely to your families. And when you arrive home, hug your children and hug your grandchildren. For me, my grandchildren are my healers and my medicine, because love. And we need to provide that space to have our hearts open and speak about love, because love is the greatest gift that the Creator's blessed us with. Chimigwej kishimanado kichimigwej onje kakina miigwej. Niboksendam Gijiminado, Niboksendam Onji Kakina, Niboksendam Minopomadzuin, Niboksendam Mashkaweziwin, Niboksendam Zagieduin. Creator, as I humble myself before my ancestors, and I thank you, Creator, for bringing the people here to gather in this circle. To all the doctors and the health practitioners, Creator, I ask that you continue to bless them with strength, Mashkawiziwin. Bless them, Creator, with good health, Minopomadzuin. And continue blessing them, Creator, and upholding them in that great gift that you have blessed all peoples of the world with and all of creation, love. And I ask, Creator, that as they return home to their families, that they have a safe travel home. And together, Creator, in this circle, as brothers and sisters, we lift our hearts in prayer to those at this moment for safety, that they've had to leave their homes. And Creator, we know that it is not the fault of Mother Earth. It is not the fault of Mother Earth for these fires. It is not the fault of Mother Earth for the floods or the tornadoes. It is not the fault of Mother Earth. But it is the fault of human beings for not respecting her. But Creator, we thank you for giving us this opportunity to come together as brothers and sisters, to share our wisdom and our knowledge, to share our strength, to do the action that is needed, to respect Mother Earth, to ensure that she will always be here for the children today and tomorrow. And we thank you, Creator, for the children who are here today and the 7 generations that will come. And Creator, I thank you for hearing the words that were shared here. Thank you, Creator, for blessing this prayer. Miigwech. So to each and every one of you, my friends, ayang guamazin ni wichki weidug, ayang guamazin nigawabmin, gizagian. Until we see each other again, take good care. There's no word for goodbye in any of our languages, but we give a blessing. We say, until we see one another again, which we will, take good care. God bless. I love you all. Miigwech. Thank you.
Miigwech, Elder Commander. Again, we want to extend a huge thank you to Catherine, Ojistoh, Courtney, Stephan, and Melissa in the last panel, and the 27 other speakers at this year's summit. And to those of you taking part both in person and online, thank you for sharing your time and your perspectives with us. Together, we can take our vision for what healthcare should be and make it a reality. And here's a quick look back at all we accomplished together here at Health Summit.